Now, officials in Tanzania remain on high alert after some 4,000 refugees from Burundi became infected with cholera, triggering fears of a growing humanitarian crisis in Africa's Great Lakes region. The UNHCR has appealed to donors for $207 million to help it deal with the refugee situation. For more on the challenge UNHCR is facing, Karine de Gruil, UNHCR spokesperson, joins us live via Skype from Geneva, Switzerland. Karine, welcome to Africa 54.
Thank you very much, Vincent.
Now, first, there has been a kind of a revision in the numbers of refugees. Previously, we thought there were about 100 and over. How many are you saying are out of Burundi?
Yes, we had to revise our figures. The number now, we're talking about 74,000 people. This doesn't mean that people are not leaving Burundi anymore. You may remember the story we talked about last week and that you just mentioned, Kagunga, where we had the cholera outbreak. We have now managed to evacuate everyone from Kagunga to Kigoma and to the refugee camp, and rather than more than 50,000 people we initially estimated to be there, we have now evacuated 35,000 people. So that counts for the reduction of numbers, but this by no means means that people are not leaving Burundi as we speak.
Now, tell us about the challenges. A few weeks ago, we spoke about some enormously, big challenges in those camps. What has changed? Are things any better?
The challenges are still there. Depending on which country, there's a challenge of finding enough clean drinking water for so many people, particularly in Rwanda, that's an issue. In other communities, the services, health services and others are stretched. We have to work around the clock to set up these services in the refugee camp. And that's why we launched this appeal late last week of 207 million with 17 partners. That's what we think we need to be able to assist and protect up to 200,000 Burundian refugees for the coming 6 months. But we're not at the number of 200,000 yet. This is our planning figure.
You're anticipating
that's what we're working with.
Yeah. Now, what has been the response up to this point?
Perhaps it's a bit too early to tell. We launched the appeal, the refugee response plan on Friday. So far, we have some indications of donors who are willing to support us, but it's a bit too early to give numbers at this moment.
In terms of the cholera infections, now the numbers are up to 4,000. Do you fear that they're going to increase even quickly, or is this situation under some kind of control up to this point?
Yes, we do. We do think it's under control. Over the last 6 days, we haven't seen any cholera-related deaths, so that's very good news. Also, the rate of new cases has slowed down significantly. When we first reported this, we were talking about up to 400 new cases of cholera a day. Now it's less than 100, so that's very good news. And it seems that the efforts that we have made of moving people from Kagunga and setting up treatment centers, sanitation facilities are starting to have effect.
In terms of the other partners you're working with, how are you coordinating the activities so that everything can be done smoothly to ensure that the refugees are getting all the help they need from all the organizations in that region?
Yes, we are working with 17 partners at the moment. That number may increase. These partners include UN sister agencies, non-governmental organizations, and of course our government counterparts. So it's basically dividing up the work, who takes care of what. Some people do sanitation, other people do shelter, and our role is coordinating to make sure that there is no duplication, so that there is not too much of one item and not enough in the other. And of course, we do our own activities as well, distribution of essential relief items like blankets and other mosquito nets that are necessary.
Yeah. Now, I know that you handle mostly people who have left the country and gone to another region. But what is the situation of those who've been displaced but are still within Burundi?
It's been very difficult to get a good picture of that situation. Actually, my colleagues have gone to the border now also to look into rumors that perhaps some people might have gone back. we understand that some people may have moved, but they're mostly with family members, host communities. So it's not the site where you see a lot of internally displaced people in one site and in need of assessment. It's more a hidden phenomenon that we know that people have moved out of certain areas, have gone back to the areas of origin, but we haven't been able to actually quantify the number at this moment.
Well, Karin, thank you very much.
Thank you very much.